मुंबई के एक प्रमुख मल्टी स्पेशलिटी अस्पताल डॉक्टर एल.एच. हीरानंदानी हॉस्पिटल ने घुटने की रिप्लेसमेंट सर्जरी वाले अपने अत्याधुनिक रोबोटिक सिस्टम रोबोटिक आर्म को लॉन्च कर दिया है। समारोह में हीरानंदानी ग्रुप ऑफ कंपनीज के CMD डॉक्टर निरंजन हीरानंदानी बतौर मुख्य अतिथि मौजूद रहे। इस अवसर पर एल.एच. हीरानंदानी हॉस्पिटल के CEO डॉक्टर समीर कुलकर्णी, मेडिकल डायरेक्टर डॉक्टर मनीष गुप्ता और अस्पताल के पूर्णकालिक ऑर्थोपेडिक एवं घुटना रिप्लेसमेंट सर्जन डॉक्टर संजीव जैन भी उपस्थित थे। डॉक्टर निरंजन हीरानंदानी ने मीडिया को संबोधित करते हुए उत्कृष्टता के प्रति अस्पताल की प्रतिबद्धता पर प्रकाश डाला। उन्होंने कहा, हमें घुटना रिप्लेसमेंट का उत्कृष्टता केंद्र स्थापित करने पर गर्व है। हमारी टीम में घुटनों, कोल्हों, रीढ़ और खेल की चोटों में विशेषज्ञता रखने वाले बेहद प्रतिष्ठित ऑर्थोपेडिक और घुटना रिप्लेसमेंट सर्जन शामिल हैं। ये रोबोटिक प्रणाली आ जाने से अब उनकी विशेषज्ञता और ज्यादा काम आएगी। ये तकनीक न केवल सर्जरी के दौरान असाधारण सटीकता और परिशुद्धता सुनिश्चित करती है, बल्कि पूरी प्रक्रिया को सुव्यवस्थित भी करती है। डॉक्टर हीरानंदानी ने जोर देकर कहा, यह मानव कौशल और अत्याधुनिक प्रौद्योगिकी के सही मिलन का प्रतीक है, जो सर्वोत्तम परिणाम और रोगी को राहत देने में सिद्ध हो चुकी है। बुनियादी ढांचे और तकनीक को लगातार अपग्रेड करते रहना हमारे अस्पताल प्रबंधन का मुख्य फोकस बना हुआ है। रोबोटिक प्रणाली के उपयोग की अगुवाई करने जा रहे जॉइंट रिप्लेसमेंट सर्जन डॉक्टर संजीव जैन ने इसके लाभों के बारे में विस्तार से बताया। उन्होंने कहा, ये रोबोटिक सिस्टम सर्जनों द्वारा अलग अलग राय पेश करने की सूरत ही पैदा नहीं होने देता और सटीक चीरा लगाने का सुविधा देता है, जिससे ऊतकों की तड़प और खून का नुकसान घट जाता है। हमारे इस कदम से हमारे रोगियों व सर्जनों दोनों को कई लाभ होंगे, जिनमें शामिल हैं ज्यादा सटीकता, कम दर्द और घाव, तेज रिकवरी, न्यूनतम इन्वेसिव प्रोसीजर, अस्पताल में कम भर्ती रहना, अनुकूलित सर्जिकल प्लान, गति और निपुणता की बेहतर रेंज और सर्जरी के सफल परिणाम।
Doing excellent work in the last 20 years, and all the time we have been able to improve the infrastructure, the equipment and other things. I must congratulate Dr. Sanjeev Jain and the entire orthopedic department and the other doctors and people who are associated with the hospital for the excellent work that is going on. We are very happy today that we have taken the next step. The next step is to add a robotic system for the key replacement surgery. All the benefits of that I will not speak because that's not my competency to do. I can only tell you that as far as the hospital is concerned, we keep on improving the infrastructure. So as you walked into the hospital, you must realize that this is a 20-year plus building. This is a 20-year plus hospital, and but it's always the infrastructure is sought to be maintained at the highest possible level. The equipment in this hospital is also being continuously upgraded, and this is one of those steps. But whenever things like a paradigm takes place, we call you to explain to you that we are now moving to the next level. So there is a positive story in terms of it. The details of that, I'm not the right person to share. So Dr. Sanjeev Jain, who looks after the entire department, and our other doctors will share with you what is it that we will bring to the patient care that we do. So ultimately, what is the idea of this hospital? Dr. L.H. हीरानंदानी, who was the founder, was Padma Bhushan ENT surgeon who did a lot of ear, nose, throat work, and it is after his name that this hospital was created. But the idea was to see that we always bring patient care to the next level, and that is what we are very proud of. So today, this is one more step in that direction which we are doing, and hence I am delighted to do. If there's anything question for me, I would love to do it because then I will leave and I leave you to the persons who are over here to take it. Dr. Samir is the CEO of the hospital. Dr. Manish Gupta is the medical director, and Dr.
Aditya Sai,
who's in the sports medicine segment, is doing fantastic work. sorry I forgot your name today, but excellent work that is happening. So they are the persons who will actually give you the further details, both of the equipment, the benefits of it. I know some of it, but I don't want to be the expert who really shares that knowledge. So I'm going to excuse myself and you will take care of this matter.
Sure.
Thank you so much. Thank you.
Thank you so much. Okay, it's navigated because it has to land in the right precise position. If an aircraft lands into the wrong position, you know what disaster can happen. So that accuracy of that perfection has been blended in these equipments on the surgical side. Now, sir, come. Aditya,
Yeah, please.
and this is a system which is from a world branded company from Johnson & Johnson, and it's called a Velis system. Now, whenever we do any surgery, the thing is that whatever steps you follow, it should be very accurate, it should be very precise, it should not traumatize the soft tissue unnecessarily. It can be done with a smaller incision, and of course the blood loss can be less. But what happens in the knee replacement surgery especially, you must have heard that, the people are not happy about the knee replacement after having it done. But it's not the case. Okay. Now, it's like if a pilot is not trained, or the passenger who is not even trained to sit on an aircraft, he'll find that it's not a good thing to fly. So the same way the patient has to have a mindset to have a surgery done, one. Two, the second thing is that surgeon or who's a pilot or a whole system should be trained to do that surgery first. It's not, the robot is not new in the medical science. It's there for years together. But here we are working in a system for last 20 years. Now when the surgery has to be done of this variety, everything is too precise. So what happens is in a knee replacement surgery, you must have seen the patient comes with a bent leg or the deformed leg. That means there is a deformity, there is a soft tissue problem, and there's a knee is arthritic completely, and we need to replace with a joint which is a metal and plastic in a layman language, but it's a very high grade metal and high grade plastic. Now that when that has to fit inside, it has to be so accurate that you need to match near to the God given cartilage. In all 3 dimensions, not in 1 dimension, 3 dimensions, sagittal, coronal and axial, dimension 1. So your alignment of the component remains good or accurate or precise to the God given, 1. 2, whatever the ligaments or structure around are there has to be balanced in such a format that the knee can function properly. Otherwise, it's not easy for a surgeon to put a knee, otherwise anybody can put the knee inside. It's like a very, very high grade precise medical, biological carpentry. Okay. Now, the same time what happens is the patient should have less pain as well. Same time what should happen, that patient should have a very fast recovery. Now today, when we talk about the recovery by doing this, today our patient goes after 2 days to the home. Now, with this system possibly we'll try to reduce half a day or 1 day. That means we can target, today world is talking of the daycare surgeries. Whether we can perform the daycare surgery with this robotic, it's possible. But we need to select the subset of the patient and we need to bring it to technology. Now, if you may ask that there are so many robots in the hospital, other hospitals, maybe for the knee replacement as well. So what's new in this hospital, what you have it here? What we have it, we are following a system for last 20 years. We have been providing excellent, good long-term results. We have practically no complications, no failure. Then what we are adding it here with the machine and technology, the experienced system and experienced surgeon there who can work better than whatever is available anywhere in the world. So we can give you the better results to our patients, precise results, accurate results, well-aligned knee and well-aligned function for the patients. Same time, recovery is quite quick and faster, and we are looking for possibly in the future the daycare joint replacement surgery in the knee. This is for the knee, but we'll upgrade it to a hip and also the shoulder and other orthoplasty. Now, this system works like this is the one part of the system which is a camera, and this is the other part of the machine which is attached to the table and works. Now, this is a robotic arm here, where when do a knee replacement surgery, there's a system which is saw works. Okay, there's a saw which cuts the bone. Now, what we do during the surgery on the knee, we put certain markers. There's a flow of the system or technique or technology which is catched by infrared rays by this camera and goes there, and everything is calculated precisely, or data is captured, okay, in this. This data is integrated with this system where robotic arm start working. Now, when my knee is like standing like here, when I switch on this system, the robotic arm automatically comes there to the knee joint and give me where the cut has to be done accurately, precisely. So I can precisely cut where, okay, using this robotic arm and the saw. So there are many cuts to be made to the bone one. The same time when I put the component inside, how well they are placed, how they were aligned inside is been seen. And then finally, the soft tissue titration or the release, because it's a biological kinematic joints, knee has to bend and function. Okay, so it has to be a stable joint with all soft tissue balances in up to the complete degree of bending in all the planes. And that is also precisely accurately seen on table live on the screen. Now, if you find as a surgeon there's something is not correct, you can rectify there and you can see the rectification effect on the screen, what is happening. So that can give you again a very precise cuts, very precise alignment, soft tissue balancing, good kinematics of the knee. So you can predict excellent long-term results, better function for the patient, better recovery, and of course when you align everything correctly, all the things are balanced correctly, the patient will definitely have a less and moderate pain or no pain. So there is a lot many benefits from using this system, and I'm sure that this technology is going to at least do good for the Mumbai's patient. And it's not that the other hospital doesn't have, you want to name that, but we are going to definitely have an edge on any of the hospital in robotic knee replacement surgery, because we have been practicing for 20 years in the hospital. As myself, I was practicing for 33 years in joint replacement surgery. So I can deal the robots like a baby, okay? And it's not that the robot is going to do the surgery, it's a surgeon assisting the robot doing this surgery. Then only it can be done. Thank you so much.
Yeah, please. Since there are two knees to be replaced,
Yes.
so pair of knees.
Yes.
So how much duration it takes for changing the other pair?
Basically, technically, see, it again depends. It's not that duration of the surgery is very important, but on an average, we take around half an hour to 45 minutes to do one knee.
One knee, okay.
When we use this system, you might use 10 minutes more because you need to put the system into the place and other thing, or 15 minutes more, 1 hour you can say. But as you do more and more number of surgery, though we were doing computer navigation since 2006 in this hospital. So for us, it's not a new, but it's a robotic arm which is going to assist us. Okay, so our time will be practically the same, maybe 45 minutes to 1 hour for one surgery. Other knee is the same, because you have to just do the other side. Both the knees can be done same way.
And both can be done simultaneously, or does it take
So we do most of the patient, more than 95 to 98% patients simultaneously, who needs it,
Okay.
who is ready for it, who is willingly ready for bilateral knee replacement simultaneously, same day, same go. After doing one knee, other knee, same day. Okay.
Thank you.
And we have a lot of benefits. We have come up with a system where we keep the patient's safety. See, why the patients are afraid for bilateral knee, but they feel it's not going to be safe. 1, they'll have a lot of pain. 2, they will not be recovered faster. 3, but we have overcome all these possibilities and they have no pain. They can recover the same way. And of course, they are managed beautifully because we have working in institution. So they are backed up for all the complications which we can predict, which will not happen, and we touch wood, we have no complication. So we can safely do it. We do that very thorough cardiac, especially the cardiac checkup, where we can determine that anything which will not affect their heart condition. And if that is the case, we defer the surgery and we ask them to go for a cardiologist to see, and then if everything is okay, then we have a surgery.
So what is the success rate of like this?
So see, the literature talks about 2 ways. Percentage, people ask, कितना percentage होएगा? पर medical science में कुछ percentage नहीं होता है. We talk about, good, moderately, okay, or better, or excellent. So far, we have been able to produce an excellent result with no complications in 20 years for any of our patients. And this can be found out, we can challenge it openly by talking to any of number of patients randomly.
But are there any risk or complications involved in this robotic system?
In general, no. In general, no, because that's very important question. Okay, because it's like somebody who's driving, he doesn't know even the driving, has been given the BMW and Audi to drive, and that in Mumbai road. So if you have an experienced team, experienced surgeon, who has a good training, who has enough experience doing a non-robotic things like conventional thing, then that surgeon can perform very well. So it's like, if you don't do it, it's like GIGO, like garbage in, garbage out. Whatever is going to feed the data for the system, that will come out. So with an experience, if you don't feed it, you will have a problem. But in general, they are designed so well, usually there is no problem at all whatsoever, you say. So there is no complication as far as, of course, this system also has a boundary, like when a bit of bone, beyond that marking, there's a marking has to be done, there is shaping has to be done, morphing has to be done, morphing has to be done. So beyond that line, if you go, the saw or the system will stop. So it will not cut, which is not required. So definitely you need to use our brain, robotic, artificial intelligence and experience there.
So is there age criteria, like age का क्या है, कितने साल से कितने साल तक? Because there are older people who don't want to, like they are hesitant, like for knee surgery, like.
Yeah. So see, it depends upon, see if patient is medically fit, okay, and if they are able to sustain the surgery and they are willing to undergo, we can do the surgery. The highest number of age, we have done it in this hospital, both the knees, 104 years.
Great.
One shot. So your Saudi patient who went away last September from here. Okay, the patient wanted to do it. He was very painful. He was on the bed for many years with the pain. They wanted him to be painless on the bed. Forget about anything. Okay, recently I have done a hip replacement for a 111-year-old patient in this hospital. Patient is still in the hospital. So age is not the criteria. Patient has to be mentally fit, physically fit, and of course medically fit. Surgeon should have guts to take that challenge, and of course your anesthesia team and system behind who's backing up should be able to take that challenge.
Okay. And how is financially viable for people, like as compared to normal?
See, financially, naturally, it's cost, technology cost. Okay, these are costly machines. I don't want to disclose the cost. Okay, but definitely. So may I invite my anesthesia team colleague also here, who is Dr. Shobit. They are wonderful people for this kind of subset of patient. When we, of course, every subset of patient, but especially when you asking the high age patient. Okay, so they are our backbones. Without them, we cannot work. But your question was. Sorry.
About the cost.
Cost will be definitely little more because we have to recover the cost of only the machine basically, which is costly. So and the consumable, there are some trackers, the material which is costly. We may not recover the cost of the machine, forget about it, because we can absorb that cost. But at least the consumable which comes, so around, you can say it varies from hospital to hospital. But we may charge one surgery, maybe I'm not sure, I've not decided, but at least some more extra money. Yes.
How many years does the implant last?
So I've been practicing for 33 years, so I've not seen any failure so far, so touch wood. So I can say 25, 30 years they last, even more than that. More than that. Again, if you don't do precisely or accurately, it will not last. So there where it adds the edge. Like if you say the conventional way, the survivorship is 95% for 15 years. With your robot, if you use, then you might say it will be 98% for 15 years. So 98% of the knees will survive. So at least there will be definitely edge. Technology will add.
And how long does it take to walk?
They walk same day.
Same day. Wow, great.
They walk same day. We are talking about discharging them the same day. So all our patients, whether the one knee is done or both knees done, they stand and walk same day. Of course, it varies from patient to patient also. It's mindset of the patient. They are not in as I say, same day. The patient was the same day. The mindset is not there. So they will not walk. You have to prepare them. So we have a pre-operative counseling for them, and we talk to them. Hi, how are you? I'm coming to that. So the counseling is part of one of the pathway, which is called a clinical care pathway, where we have developed a system for the last 15 to 20 years, where what we do is basically where we counsel the patient preoperatively. Okay, our pre-anesthesia people, anesthetic people, they talk to them. Okay, our physiotherapists talk to them that what will happen when they are in the hospital. So they come with a prepared mindset. Okay, and of course about the pain. The pain is basically, wo bolte hain na, everything is in the mind game. So you must have seen so many cancer survivor patients, like somebody has bad cancer but he survived, and somebody has even hardly anything in the cancer and every possible treatment then could not survive. So reason is that everything is the mind, and everything is the mind. That means when your mind is set, your whole body or biology works that way to fight. Okay, you give the medication, but when your mind is set, your biology is set, everything is going to trigger and hit that thing, which is not good for the body. That's why I say everything is in the mindset. So mindset the patient, if it's correct, then pain is practically nil or negligible. Because pain is a perception. If I was hit by somebody, I may not cry because I'm a tough man, but somebody hits this guy, he may cry for 10 days with a less impact even. So it's the patient perception for the pain is different. But once we convince them, and we can also, what we do is we ask them to give randomly. If you wish, you can talk to some patient who have been operated. How was their effect? We don't say there won't be any pain. It's a human body, there will be some pain. But it's negligible or no pain. That's why we are doing our 95 to 98% patient both knees together same day. Because we control the pain. Not with the medication, with the anesthesia department, with all the time together, but we also control by setting their mind correctly.
So how many surgeries you have performed in this hospital?
That's
Approx.
So, करीब 7-8 हज़ार तो होगा और ज़्यादा भी होगा सर.
Great.
Thank you.
Sir, when you operate from this robotic
Yes.
arm and then normal procedure,
Yeah.
how much time you can reduce?
Reduce in with the robot. See, robot से थोड़ा time ज़्यादा लग सकता है. We were talking about, they asked this question before. But when you do more and more surgery, I've been doing computer navigation for many years. So our non-computer or computer is practically no difference. So robotic also you can take at least little more time sometime. Okay, people talk in general wrong because it's just you're adding to your procedure. Okay, so it will take 10 minutes or 15 minutes more. But with the time we can also match your non-robotic time. No.
And it can also reduce the blood loss or something like that?
Yes, blood loss. See, basically when you cut the tissue less, naturally there will be less blood loss. Okay, when you cut once the bone, you have less blood loss. Okay, so it depends. Okay, but blood loss is definitely less with the technology when you use it.
And this is the only robot here in this hospital, or is it in Bombay you will find somewhere else also?
See, there could be a couple of robots in Mumbai. I'm not saying that I've told to them, but I told them what is the advantage of using a robot in this hospital. We have been doing for 33 years. I've been practicing 33 years in this hospital, 20 years. Okay, so you can have a grades of pilots, you know, who can fly the better flight. The high risky, okay, airports like somewhere in the country, you will see the Facebook and see there are some, आजकल दिखाते हैं ना, वो कोई फ्लाइट से ऐसी भयानक जगह पे उतर रही है आप सोच भी नहीं सकते, और फ्लाइट को चलाने के लिए जो पायलट बैठा है, that's very important. So we have it here. We have been doing years together, and we can do a better, definitely a better job than available anywhere.
Doctor, does this system require any calibration after?
Yes, it has to be calibrated. During the surgery, it has to be calibrated. Data has to be fed. That's how it comes. So there's the whole flow of the system.
Yeah, thank you.
Thank you.
Thank you.